Thank you all for coming today to our Kernel of Knowledge webinar series from the National Network of Libraries of Medicine, hosted here at the University of Iowa, hence the Kernel and our Kernel of Knowledge. All of our webinars are recorded, and I'm going to put the link for the closed captioning in the box again here in a minute. Today we have a special guest. Erica is going to be talking about this wonderful program they're doing at her library on providing food to her community. I want to give her all the time that she needs and save plenty of time at the end for questions, so I'm going to go ahead and hand it over to her.
Thanks so much, Bobby, and a big thank you to the National Network of Libraries of Medicine for sharing our story and giving us this opportunity. And I'm so glad that so many people have joined us today, and hope that you all take advantage of the many fabulous grants and opportunities available through NNLM. I've done some of them, and we've always had a really good time. Also, thank you to all of you for joining me today to hear our story about how some small rural libraries were determined to improve adult literacy and ended up reducing food waste, improving food access, and addressing food insecurity. I just also want to give everybody a heads up. As you know, librarians are excellent at sharing, and we have all been sharing a bug that's been going around the office. So I'm going to do my best to not cough and sneeze through this, but if I do, that's what's going on, and I apologize ahead of time. So let me see. Oops. Hang on. Oh, there we go. Our story begins in the summer of 2018. When a 76-year-old lifelong resident of Granville, New York, came into the Pember Library and Museum, breathless. She had just had her first taste of a fresh beet, and she wanted to tell everyone about it. So whether or not you're a fan of beets, the experience of eating a fresh vegetable was so extraordinary that she returned to the library to talk about it because that's where she had gotten it. The Pember Library and Museum is a part of the Fresh Food Collective Farm to Library Distribution Initiative, which is a partnership between the Southern Adirondack Library System and the Comfort Food Community Food Pantry in Greenwich, New York. We glean from local farms and share the bounty through public libraries. It's a simple idea with big impact. I'm sorry, I'm having an issue. I don't know why my slide doesn't want to advance. One second. We'll try it here. Okay. So before I get more into the story, I want to give you a bit of background. I'm the outreach and engagement consultant at the Southern Adirondack Library System in New York. And for those of you who are not from New York or who don't know how our libraries are organized, we are divided, all of New York is divided into 23 territories for public libraries, and each one has a system, which means that I don't work directly in a public library, although I did for many, many years. Right now, I serve 34 member libraries, and each of our member libraries is completely autonomous. They have their own board of trustees, their own charter, their own budget, and their own director. I work with them specifically to meet the needs of their communities, and particularly communities that tend to be underserved. And this is where we are, to give you a sense of where we are in New York. Because I know when people hear New York, they often think of the city, but actually the majority of our state is very rural and country. Our 34 member libraries serve 4 mostly rural counties, and you can see them here. They're Hamilton, Saratoga, Warren, and Washington counties. Our smallest library serves 114 people. Our largest serves more than 56,000, and that's an urban library in the city of Glens Falls in Warren County. Hamilton County is the least populated county east of the Mississippi, and there are just 5,000 residents in the entire county. and no stoplights. Fun fact. It's also mostly in, as you can tell from our name, we are in the Adirondack Mountains, and Hamilton County is mostly mountains and trees. Washington County, which you can see all the way over to the right, is borders Vermont, just to give you an idea of where we're located. And I have to admit, I have the best job. I get to work with libraries to create thriving communities and help people live their best lives, which is awesome. I do that in lots of different ways, but today my focus is on our Farm to Library initiative. So before I start to share our tale, I want to find out more about you. Oh, so I'm sorry, I'm just looking at the chat and I say, trying to get folks to realize that's very difficult. I was born and raised in Delaware and Chenango counties. Yes, so Beth understands just how rural New York is, and it's very different from people's perceptions of it. So I wanted to ask you now if your library currently is feeding people or provides opportunities for people to share food. And you can just put a note in the chat box about whether or not you do, and if you do, what sort of food programs do you have, or how are you implementing that? And I'll give you a minute to do that.
For those of you that haven't used Zoom before, what you can do to access chat, if you have it in a full screen mode, put your mouse towards the top of the page, and there should be an option then on the drop-down menu to exit full screen mode, and that might put your chat box up on the right-hand side, or if you put your mouse down at the bottom of the screen, under the More menu, there will be an option to open the chat.
So I see a lot of people are saying no food programs at this time, but Ashley says she works with, oops, hang on, I just lost it. Works with several libraries in South Carolina that provide food programs, farmers markets, a garden, and a produce box program. Awesome. I love it. Somebody else does summer feeding, which I'm guessing is like our summer lunch program. And then we also do pop-up markets when the food bank brings fresh produce or other items. Awesome. Yes, they would like to expand those because of the need. Indeed. Beth, I feel you. And Tony has afternoon snacks and summer meals for students. Fabulous. There is nothing better than feeding kids, I have to say. And Celeste said they served as a site for a local nonprofit to provide lunch. Awesome. Oh, somebody has a seed library. Nice. And have been a summer lunch site. Very cool. Oh, I love the idea of food entries into a prize drawing for the summer reading program. Candy, donuts, treats for students. Yay. Oh, that's really, Robin, the raises a really important issue at a lot of colleges and universities. I know my friends who are academic librarians have talked about this. The issue of students who are food insecure, which is a big issue to address. Somebody else has food banks in their communities. Awesome. Oh, and somebody is a food grower looking for creative and new ways to market. Excellent. Food drives at the library. Somebody from Rochester. Woohoo. Partners with Goodwill to help with needs like food and shelter. Awesome. School district has a food truck that brings lunch in the summer to the public library. What a great idea. And yes, somebody said this is making me hungry. Agreed. But that is my constant state. So thank you all for giving me a sense of what's going on in your communities, and I'm super impressed to hear about the many fabulous things going on. Oh, food for fines. Well, that's still collecting and getting money out. Oh, and other people are getting qualified to collaborate with local food banks and libraries. Awesome, awesome. So why? All right, so this apparently, there we go. Why would a public library want to distribute fresh fruit and vegetables? I always like to begin, as Simon Sinek reminds us, by talking about why we do what we do. And there's several whys that inspired the Farm to Library project, but the biggest for me is this, that we're here to help people live their best lives. And for some communities, that means meeting basic needs so that they can make space in their lives for things like adult literacy and other opportunities to learn and grow. It's hard for people to think about taking their children to library programs or getting their GEDs or task when there are obstacles to meeting their most basic needs like food. It's also because up to 40% of the food grown, processed, and transported in the United States, which it comes to about 150,000 tons each year, is wasted each day. That means to about 400 pounds of food loss for every person in the US per year. The cost of that food loss is estimated to be $218 billion per year. That's billion with a B. And 20 billion pounds of produce is lost on farms each year. The food that's lost is considered food waste, and it is the largest component of municipal landfills, and it emits about 3.3 billion tons of greenhouse gases every year. According to the book Food Foolish by Eric Schultz and John Mandyke, if food waste were a country, it would be the third largest emitter of greenhouse gases after China and the US, just to give you a sense of the problem scale. So farms are the first link in the food supply chain and are responsible for 16% of the waste that comes from food loss, which means that food never makes it off the farm. In the US, food production requires a lot of resources. It uses 50% of all the land in our country, and 80% represents 80% of all the fresh water consumed. Food waste on farms happens for a number of reasons, including farmers need to plant more than they can sell in order to protect themselves against unknown factors like pests and weather. Crops sometimes go unharvested if the cost of transportation and labor is higher than the market price of produce. Sometimes um, fruit and vegetables don't look like, or they may be imperfect or ugly. They don't look like something from an Instagram shoot, so people are reluctant to eat it. And most recently, labor shortages caused by changing immigration laws means that farmers are forced to leave food in the fields because they just don't have the necessary manpower to harvest it. So at the same time that this food waste is happening, according to the USDA, 15 million households experience food insecurity. And that means 50 million Americans, including 16 million children. Having access and the ability to purchase a variety of food is considered a social determinant of health. And if you're not familiar with the term, social determinants of health are the conditions in which people are born, grow, live, work, and age, and all of which have significant outcomes on people's health and well-being. So a social determinant of health includes um, the availability of resources to meet daily needs, socioeconomic conditions, and overcoming social isolation, which are some of the things that our program does try to address. And I want to point out that one size does not fit all. Food insecurity does not always look the same. It can be a one-time occurrence or seasonal. It might be chronic, or it could be related to a change in family income. In rural areas, it's often tied to a lack of transportation because grocery stores or markets can be many miles away. And if you don't have a car or there's only one car in the family, it's a major obstacle. And people develop a lot of coping strategies to food insecurity. And those strategies may include skipping meals or purchasing the cheapest option, which often leads to diets that are heavy in highly processed food, which ends up compounding their stress and leads to chronic disease. For um, people in rural communities, and this is at least true in our area, Grocery shopping often takes place at a dollar store or a gas station because that is what exists where they live. And at these stores, options are limited, again, to the highly processed foods I just talked about. And if there are any remotely healthy options, it might be a piece of fruit or a garnish for a sandwich. And that's just the reality. There aren't any grocery stores within walking distance, or sometimes you're looking at least half an hour to get to a grocery store, and we have no public transportation. For families who do have a car, often that one car is used to get to work, and people in our area tend to work more than one job to make ends meet. And so getting to a grocery store is it's too difficult. The counties we serve, ironically, are mainly agricultural, yet despite an abundance of fresh local produce that is exported elsewhere, many of the towns and villages in these counties don't have access to the food grown nearby, and as I mentioned before, really limited access to grocery stores. So the libraries I'm talking about today are all located in rural food deserts with limited access to nutritionally rich food, where public transportation is non-existent, and Uber and Lyft, I know that those are great services, but those are for city folk. We do not have that where we are. People shop at what are considered subprime grocery stores, where fruit and vegetables, when they exist, are very expensive. And while we do have food pantries in all of these communities, they're run entirely by volunteer staff. Like even our fire departments, it's all volunteer. So the food pantries tend to only be open for a couple hours each week, or sometimes a couple of hours a month. And because of their limited hours, they're really reluctant to stock fresh fruit and vegetables even when they're available. And I have to say, as someone who lived the majority of my life in cities and grew up in an urban food desert, I was really surprised to learn about the challenges to food access faced in rural areas. I thought, like, oh, if you're living in the country by farms, what's the issue? But according to the Rural Sociological Society, nearly 98% of food deserts in the US are in non metropolitan areas. The challenges are exacerbated by a lack of federal funding, which is based on population counts. And as urban areas have continued to grow, rural areas have been depopulating, which affects funding for services like food pantries. So, as all this is going on, local community health organizations are at the same time alarmed by the rise of chronic diseases and poor health in our region. And they're really concerned about how it's affecting ongoing learning, developmental issues, productivity, and physical and mental health challenges that are created by food insecurity. In Washington County, where 3 of the 4 participating libraries are located, 32% of the population is obese and 11% have diabetes. This poor health often results in missed days at work, and for many of the people who are working in our area, they do not have jobs that offer sick days or health insurance or any of that. So if you miss a day of work, that means that you're not getting paid for that time. Excuse me. And in addition, annual health care costs in households with moderate to severe food insecurity tends to be $500 to $1,000 more a year than for those that are food secure, which just adds to the issue. So, given this set of challenges, what are small rural libraries to do? Excuse me, I'm very sorry. We found an amazing partner in Comfort Food Community, a food pantry based in Washington County, and work with them to develop the Farm to Library initiative. The idea was really simple. We're going to rescue food and improve health and people's lives. The implementation, of course, is a bit more complicated, which is why we're incredibly fortunate to have a terrific partner. So the process begins by recruiting volunteers to glean produce from farms that would otherwise go to waste. In case you aren't familiar with the term, gleaning is when we go to local farms and harvest the fruit and vegetables that will not be used. So farmers tend to plant excess crops, like I mentioned before, because you never know what's going to happen with the weather or with pests. And so whatever is left that they can't get to market, that's when we'll get a call where actually Comfort Food Community gets the call and says, we have excess. If you can get somebody out this morning, you can take it. Um, Once the gleaning is complete, the rescued food is then packed and distributed to 4 libraries in rural food deserts. And it's tricky, right? So the hard part about this is finding the gleaners. It's not a paid position, so we depend on volunteers. And one of the challenges of gleaning is coordinating with participating farms. And now we have 23 local farms that are a part of this project. But a lot of times the farms don't know that they have food to be rescued, or they don't let us know that they have food to be rescued until the morning of the day it needs to be done. And so gleaning often has to be done really quickly so the farmers can turn over their fields later in the day. This requires a nimble, dependable volunteer force that is willing to work early mornings in all sorts of weather. And we've lucked out because Comfort Food Community got a grant that provides funding for a food recovery manager who coordinates that effort. So we help spread the word and recruit volunteers, but we don't have to do the actual gleaning. So food recovery is a critical component of the initiative, which is why we glean from local farms. Food recovery rescues and diverts up to 1.1 million tons of waste each year. By rescuing food, we're able to provide healthy food to improve the lives of our communities while reducing the amount of food waste. So it really is a really nice win-win situation. And as you can see from the Environmental Protection Agency's food recovery hierarchy, what we're doing is taking action at the top of the model by using produce that would have otherwise been discarded or plowed under and distributing it to people who need food. So this journey, like many, began with a conversation. In the spring of 2017, I met with Kathy Varney from the Glens Falls Hospital, who was coordinating a New York State Department of Health grant. And she came because she was trying to get us involved with that grant, which was about providing healthier snacks at our meetings and encouraging our member libraries to choose healthy options when they were serving patron snacks. So as we were talking, she mentioned some of the other projects that she had going on, including a collaboration between the hospital and Comfort Food Community. And what had happened is that Comfort Food Community is a relatively new pantry. It's run by this guy named Devin, who is just kind of this amazing, charismatic go-getter who really has this vision that, you know, when everyone eats, all are nourished, and really is committed to getting as many people fed as possible, and is full of energy and is really terrific to work with. So, and he had been doing great work with the local farms around cleaning, and they had run into the problem, which is a great problem to have, where they had way more food than they could distribute. So they were trying to figure out how can we distribute more food to a larger area to use up all of this food waste, that all the food we're rescuing. So Kathy was able to use some of her grant funds to purchase a large cooler that was installed in Glens Falls, which is in, so Comfort Food Communities in Washington County, Glens Falls is in Warren County. And by installing a large cooler, that could increase the food bank storage capacity, but also create a hub where other food pantries and food banks could come and get the fresh produce. And they also were floating around this idea of creating mobile food distribution units. And they were looking at specific communities that were part of a designated area that were having significant health challenges and wanted to bring more fruits and vegetables there. And so they had started. And while we were talking, Kathy mentioned several communities where they couldn't figure out a way in. Like they didn't have the contacts and they couldn't figure out how to get food to the people who needed it. And it just so happened that each of those communities had public libraries. And I asked her, I was like, would you consider distributing food through our libraries? And at first she was completely shocked and she kind of sat with it for a minute. And she's like, it never occurred to me that we could that we would use libraries for that. And I just want to stress this, that just because someone isn't doing it already or hadn't thought to include libraries doesn't mean they aren't willing to work with us. And there's tons of opportunities to partner and collaborate on a wide range of issues that affect our communities. So seize them when you can and don't be afraid to push the envelope. So Kathy liked the idea, and she's put me in touch with Devin at Comfort Food Community, and we began to work out a plan. So that summer, we beta tested the idea with the Hadley Luzerne Public Library, and this library serves, excuse me, 2 towns that are in adjacent counties. And once a week, a van with fresh produce was going to stop at the library, in front of the library, and I was so excited and couldn't wait to launch the program. This model required volunteers from the library to go to Glens Falls, which is the closest city, because Lucerne is in Warren County and Hadley is in Saratoga County, I think. Yep. So they had to go to Glens Falls, which is about 30 minutes away, to get to the new cooler, to get the vegetables that Comfort Food Community was dropping off there. So volunteers would pick up the produce and have some items available at the library, but the majority was available through the van delivery service. So the good news is people in Hadley and Lucerne got fresh fruit and vegetables that summer, but it was a bit of a bumpy start. Since funding was coming from a state grant, participants had an income qualification. And I did not want to implement it, but was overruled by my community partners who were obligated to collect that information to meet the grant requirements. I felt the qualification was demeaning for participants and was concerned that it violated patron privacy, but weighed that against the possibility of improving people's lives and developing a relationship with Comfort Food Community. I acquiesced and just want to say it was not my finest moment. So, but there you go. Comfort Food Community had mapped out about 20 stops to hit during the day, and each stop lasted about 20 minutes. And as you may imagine, a 20-minute window in the middle of the day was not the best way to reach people. And if the van was running off schedule, which it did frequently, people either had to sit around and wait, or worse, if it arrived early, which it did sometimes, they missed their chance to get fresh produce altogether. So the pilot year was not perfect, but we learned a lot. Um, and one of the things that we learned was that all of the library staff, including the director, qualified for the program, which says a lot about wages in small rural libraries. And that is something that is not acceptable. We also learned that despite what experts serving this community had told us, people had an unquenchable desire for fresh fruit and produce and were willing to try things they didn't recognize if provided with a bit of guidance. And I just want to take a moment to point out that people who work with marginalized communities are human, and we all bring our own biases to this work. When I began this project, people who worked with this population told me that people experiencing food insecurity wouldn't want fresh fruit and vegetables, that their palates had adapted and they would only eat sugary processed foods. This information is false and really harmful. People may mean well, but our experience has been that all people of all ages enjoy having fresh fruit and vegetables, and some of the most eager eaters are children. So please don't let common wisdom discourage you from trying something. People who have obstacles in their lives have a right to good, healthy food, and if we can help provide that, let's do it. And that is the end of this lecture.
Great. Thank you so much, Erica. This was
Oh no, I'm sorry. That was just the end of that editorial note. I was trying to advance the slide. I've got more. Sorry.
I'm here for more.
So, in the summer of 2018, Comfort Food Community secured a grant through the New York State Department of Health's Hunger Prevention Nutrition Assistance Program, what we call HIPNAP because nobody can say all those words. The grant provides funding for a food recovery manager who coordinates gleaning volunteers, sorting and delivering the produce, to our participating libraries and installs small glass front refrigerators at each library to help keep the produce fresh. So the new incarnation of the Farm to Library project had several significant changes. The first was there was no qualification to enjoy the food, and this was really important. We really wanted to encourage everyone to help themselves and enjoy it and remove any sort of stigma or shame about it. The idea was that we have all this abundance in our community. There's all of these great fruits and vegetables. Everyone should help themselves and eat what they like. We also wanted to bring new people into the library, and that we thought that this was a great way to build community through sharing food, swapping recipes, and stories. The second change was that the produce was now delivered directly to the libraries and was available as long as the library was open. And although many of our libraries have limited hours, like our Whitehall library is a tiny library that the director also runs the Head Start program in the community. And so the library opens when she finishes her other job. So they're open from like 4 p.m. to 8 p.m. And a lot of our libraries have um, very abbreviated hours because that's as long as they can be open. Um, but even with those abbreviated hours, they're still open more often and as or more accessible as local food pantries. Oops. So we launched the summer with cooking classes by partnering with the Cornell Cooperative Extension. And in the middle of your screen in the red shirt, that's Chris Nestle from Cornell, who did a fabulous cooking course. We provided easy recipes that only took like one pot or one bowl to make. And each library had laminated pictures identifying the fruits and vegetables with information explaining what each vegetable was, their flavor profile, as well as how to cook and store them. And each library was getting produce delivered on Tuesdays because that was determined as the day when all of our libraries were open similar hours, which made the delivery easier. And as you can see, our libraries just kind of put the produce wherever it fit. And all the way to the left is at the Pember Library. They have in the middle of the room these low bookshelves, and so the top of the bookshelves were perfect for displaying the fruit and vegetables, and they had some beautiful baskets, which they did a really great job of display. So within 2 weeks of starting, our libraries were reporting that they were running out of produce shortly after their delivery, which meant that we started a second weekly delivery just to keep up with the demand. And one thing that we noticed at the beginning of the program when it first launched, there was definitely some hoarding behavior, but all of that resolved itself without having to say anything within a couple of weeks, as people realized that this was um, a regular stream and it was going to be available every week and that they didn't have to try and get it all at once. And as I mentioned before, while experts who work with low-income people told us that fruits and vegetables would be a hard sell, that was not our experience at all and has not been. Low-income families, like everyone else, love having access to fresh produce, which now represents the majority of the food that's distributed through the comfort food community. So one of the things that we learned is that there's more surplus food available at local farms and within the food system than we can distribute. So scarcity is a myth that we need to vanquish. It's not that we don't have enough food for everyone, it's that we just need to be able to get it to them. The other thing we learned is that people are incredibly generous. This initiative would not be possible without the volunteers who get up at 5 a.m. to glean, without wonderful partners like Comfort Food Community, our member libraries, and our communities. As people came by to pick up a clove of garlic or a quart of blueberries, they often dropped off a couple of dozen eggs from their chickens. And in the summer, people shared overflow from their garden, and which in our area means that we get a lot of zucchini and summer squash, a lot. That first full summer in 2018, we shared more than 2,500 pounds of produce over 3 months, which barely puts a dent in the amount of food wasted each day, but significantly improved the lives of people in our community. The Schuylerville Public Library, which is just 10 minutes away from Comfort Food Community, ended up getting deliveries all winter long because the need was so great, and managed to rescue an additional, I think it was around 600 pounds of root vegetables, salads, and hardy fruit like apples. So this summer in 2019, we expanded to include the Argyle Free Library, and more farms were welcomed into the program. All libraries got deliveries 2 times a week during the summer, but when it came to the fall, Argyle and Whitehall cut back to 1 delivery a week. And the reason was really interesting to me. We figured it out that was once kids went back to school, the demand went right way down. And part of it was that in many cases, kids were the ones that were coming to the library to pick up food for their family. And once they're in school, they're not doing that anymore. And also because they're getting meals at school, the demand had decreased. So moving forward, what does it look like? As the project continues to grow, so do the opportunities, which is very exciting. Over the past 3 years, we've proven to be good partners, and it's allowed us to get to know our patrons better, and we've seen a ton of new faces in the library that had not previously been using the library. And like I said, the Schuylerville Library has been providing fresh produce year-round, and when Granville, or the Pembroke Library Museum in Granville, heard about that, they're like, we want to do it year-round. The trick is, although the Pembroke Library Museum is in the same county as the Schuylerville Public Library, it's about 45 minutes north, and our winters can be tough. We can get a lot of snow and ice and other stuff, so that drive becomes really challenging. So regular deliveries are not really an option in the winter. But we ended up getting really lucky because the Glens Falls Hospital had grant money it was willing to invest, and they purchased this amazing, you can see it on the left, a grow tower. Oh, I think it's called a Tower Garden is its official name for the Pembroke Library and Museum. And I love it because it looks like exactly as I imagined the future would look like when I was a young child. Like, yes, we'll all have these in our homes. It's super cool. It's a completely contained growing system. So the library started with seeds, and once the seeds started to sprout, they placed them into the grow tower, and it's allowed them to produce fresh greens and herbs to their patrons through this winter. This is the first year with it, and it's doing really well. You can see it's not a great picture, but in the upper middle, they've got bags of gourmet lettuce and arugula. And I've included a Facebook post because it makes me really happy that the library always posts when they've had a delivery, what kind of fruits and vegetables they have. And and I guess I should explain that a lot of our communities were very small and very rural. We don't have newspapers or any other way to communicate. So social media is really the main way that we communicate with our communities. And so they can post like what they have going on. And here when they posted that, they'd harvested some lettuce and arugula, and someone got in touch and was like, oh, what's the price? And they're like, it's free. How fabulous is that? The Glens Falls Hospital also provided a hydration station, which was amazing because in our areas we rely on septic services. And Granville, where the library is located, was once a manufacturing town, and much of the groundwater is sketchy at best. So by providing a hydration station, it means people can come in and regularly access fresh filtered water. They can fill their bottles. And the library is able to provide another needed service. In a couple of weeks, I'm meeting with my contact at the hospital to talk about next steps, which is to create a small country cupboard with basic personal hygiene items to add to the library's collection. And I'll be hoping to be able to report about that in a year or so from now to see how that's going. So as we prove ourselves as partners, more opportunities begin to become available. The Greenwich Free Library, which is located in the same town as Comfort Food Community, didn't participate in the Farm to Library program because their community is so well served by this extraordinary pantry. But what they did do is partner with Comfort Food to create edible education. And um, and this is, you can see at the top, it's it's a series that is for both adults and children. And the first adult class took place at the food pantry, which recently moved into a new building and now has a professional kitchen. And they taught people how to make cheese using items from the food pantry. And in some of the pictures on the left and on the one picture below, the Comfort Food Community came to the Greenwich Free Library during a toddler story time to talk about fruits and vegetables and how much we love them, but also how to prepare them. And as you can see, it was a huge hit. The kids loved it, and they love getting to eat what they make. So what this program shows me was that, like 2 years ago, when I was thinking about, how do we bring new people into the library and encourage people to realize their dreams, and how do we meet their adult literacy needs? It's like we need to build trust with a community that is not going to come to the library for another reason. And I still believe that our strategy of meeting people's basic needs will lead to improvements in literacy rates, although I don't have any evidence yet, but we are working on it. I do know that we're improving people's lives and that really great things happen over food. So as Comfort Food Community goes to the Greenwich Free Library, the Greenwich Free Library in turn has partnered with Comfort Food Community to provide early literacy services at the food pantry. In the picture at the top right, you can see the intrepid Annie Miller, who is the library director, assembling some rolling shelves for the pantry. The picture below shows Deb, the youth services and outreach coordinator, playing with a young patron. So this model of food-based community outreach is based on the excellent work being done by Betsy Kennedy at the Cazenovia Public Library. And they began providing early literacy programs at a food pantry in her region and grew the program to where they now graduate high school equivalency classes a couple of times a year. We haven't gotten that far yet, but that's the model that we're following, and we're really thrilled to see this work that Greenwich Free Library is doing with Comfort Food Community. And I just want to say, I want to acknowledge that this project doesn't exist in a vacuum. It's really building on ideas that other small rural libraries have done, like in Cazenovia, and supports the excellent work being done by our own member libraries. The Schuylerville Public Library and a number of others have been providing summer lunches to children for years, and Schuylerville has a backpack program to help get families through the weekend. So in 2019, we were incredibly lucky and were recognized for our work by the Public Library Association with the Library Innovation Award. We appreciated the recognition by our peers, and we really appreciated the accompanying money, which allowed us to develop some marketing materials to help spread the word about our project. So we worked with a local graphic design team that produced material for Comfort Food Community and created bookmarks and rack cards that we could distribute in post offices, doctor's offices, laundromats, and through Head Start programs, and through other people who do WIC in our area. Kind of anywhere we thought people might go who would benefit from the service. And as I mentioned previously, there aren't many formal news outlets in most of the communities we serve. So the graphic designers also created a number of pieces for social media that our libraries could use, and even designed website headers for the participating libraries. And that was something really great that we couldn't have done on our own. And I should say that this program, while it has cost me my time, we have not actually had to put any money into it. So we're managing to do all of this on with very limited resources. So As I said, 2 years ago, I wanted to bring new folk into the library and encourage people to realize their dreams. I also really wanted to improve adult literacy. Um, I still believe that the strategy is going to work. And at the end of 2018's program, we asked people using the program to respond to a survey, and 62% of participants reported that the price of fresh food was a barrier to their being able to purchase it, but they were delighted to try new food through the program. And 100% of respondents said that eating fresh produce was important to them. In 2019, more than 820 people enjoyed more than 3,000 pounds of food. And I'm really excited to report that we're going to be able to bring on a fifth library, the Corinth Free Library, in 2020, and look forward to watching the program continue to grow. So while this work benefits our local community, it also corresponds to the Sustainable Development Goals established by the United Nations. I believe that libraries have an important role to play in ending hunger, and our experience demonstrates that any size library can do this work. By joining with other stakeholders doing this work, we can ensure sustainable consumption and production patterns, we can reduce inequality, and contribute to improved health and well-being. It's important and gratifying work and delicious work, which has the added bonus of bringing new faces into our libraries. But we can't do it on our own, and we don't have to. By partnering with other community stakeholders, we can change the world one community and library at a time. And what could be more delicious than that? So I am very happy to answer any questions that you might have about what you've heard today.
This was great. Erica, thank you so much for sharing this with us. You do have a couple of questions in the chat box. Would you like me to go ahead and read those to you?
Yeah, I'm sorry. Somehow I've managed to lose my control, and I don't know where my chat box has gone.
Sure. So someone is asking if you had used grant funding to purchase the tower garden that you showed?
So that was actually the Glens Falls Hospital had a grant to improve community health factors in a specific set of communities, and Granville was one of those communities. And so they actually were trying to figure out ways to spend their money, which is a great problem to have.
Mm-hmm.
And as I was talking to the outreach coordinator, she's like, "Oh, we've got this money to spend." I was like, "Hey, you know what? Granville, Pember would love to be getting deliveries year round, and we can't afford to do that. What could we do?" And I didn't even know about the Tower Garden. She knew about it. She's like, "How about if we get this?" I was like, "Yes, please." So a lot of times it's just lucking out. And like I said, it's being a good partner so that people want to continue to work with you. So we just got really lucky on that. But I think I did look it up yesterday. I was like, I wonder how much these, I think they're about $1,000. So it's not, I mean, so it's hard to like put that in context. Like for some of our libraries, like that's all the money in the world. We have libraries that their annual budgets are like $20,000. That's a huge lift. So getting this from somebody else was huge. For other libraries, it's not that huge of an expenditure, but it's super cool. And I'd like to see them in more libraries for sure.
Great. Looks like the next question is, you mentioned getting funding from NNLM. Did you use any funding from NNLM to advance these projects or this project?
Oh, so the grant that I did through NNLM was actually a completely different project. It was called Library Moonwalk, and it was about encouraging public-facing programs and getting people to move more throughout their day. So this was not related to an NNLM grant, but I like that idea, and now I will think about that. Thank you.
I think there was a webinar on the Moonwalk, wasn't there?
Yes, there was. Yeah. So if you want to find out about the Moonwalk, I think it is archived. The webinar about it's archived somewhere.
Yeah, I think it's probably on our YouTube channel, the NLM YouTube channel.
Yeah.
Yes. Okay. And then next question is, this is a good question. Did you have any problems with insects hitchhiking a ride into the library on the produce?
No. So all of the produce is actually washed before it comes to the libraries, and they do that at Comfort Food Community. So we don't have any more insects than we normally do in the summer in the country. So yeah, so that has not been an issue. And we also, because everything, unless it's like hardy root vegetables, tends to be in the refrigerator, and the refrigerators are cleaned out every week. We haven't had any problems with, um, rotting or rodents or anything like that. Any more than you normally have in a country library. That's all I'm going to say.
Did you have any statement or agreement about protecting the participating organizations against someone indicating they got sick from the produce?
Oh, we do not. That's interesting. I hadn't even thought about that. No.
Yeah, okay.
Maybe
No.
we should think about that. Yeah.
Do the surveys you administer track dietary changes? For example, increase in the fruit and vegetable consumption since the implementation of the program?
No, but we'll add that to. Actually, no, I'm saying that, and the first year we did ask that question if it increased the amount. This past year, there's a new food recovery manager who didn't do the survey, and that's one of the things I definitely want to bring back for 2020. So we did do that, and I can't tell you the exact percentage, but I could get that information to Bobby after this call. But they did report that it was a significant percentage reported that it did increase the amount of fruit and vegetables in their diet.
Great. Let's see. Did you have any feedback from the farm or farmers with the overall experience with the volunteers and gleaning? Do the farms claim tax deductions for a charitable donation?
Oh, I don't know if the farm, that's interesting. I don't know if the farms are claiming, are getting tax deductions. I can ask about that. I do know that Comfort Food Community does a tremendous job of managing this because we've seen it grow from the first year. I think there were like 7 farms to now being 23 farms in a really short period of time, which means that as the number of farms participating expand, the amount of produce is expanding, which is why we're trying to, while there's really the funding that HIPNAP is providing for this program, it was a 5-year grant, so we have another couple of years on it, was really meant to cover just libraries in Washington County. Because of the sheer amount of produce, we're starting to expand that as we can, and we're adding Corinth because Comfort Food Community has another really terrific program called the Pharmacy. That's pharmacy with an F, where we have local doctors writing prescriptions for fruit and vegetables to low-income clients who are experiencing health crisis. And as Amanda, who's a person that coordinates that program, travels around, she's able to bring fruit and vegetables to more of our libraries. So that's how we're able to expand that. Did I answer the question, or did I go down a rabbit hole? That could happen.
I know, I think one part got missed is if there was any feedback with the experience with the volunteers and the gleaning from the farmers.
From the farmers, the volunteers all really love it. It's like a very small, committed crew of gleaners who really get into it and enjoy it. The farmers like it because it means that, they've worked really hard to grow all these crops, and so it's nice when it's not wasted. I know that initially there was some concern. People were saying, won't the farmers be upset if their produce is being given away if they're also trying to sell it in farmers markets? But where the libraries that are doing this, first of all, there are no farmers markets there. Like there's no place where this stuff is being sold that people could get it anywhere else. And the farmers are selling enough at market that this is the surplus that they don't have anything to do with. So it's been good.
Okay, and then in terms of partnerships, what type of buy-in strategies do you incorporate?
Um, well, I guess what it is, it's just kind of what kind of strategies. That's interesting. I think I guess it's just really, for me, it's all about my only strategy is just talking to people and having conversations and seeing where our interests meet. And, as when that first conversation with Kathy Varney and her talking about this obstacle that she faced about getting fresh food into communities, the first thing that clicked was like, oh, we've got libraries in all those communities. Like, we can totally help you do that. So I think it's more of just, I guess my strategy is just to exploit every opportunity that comes my way and to think about, like, how could this impact our communities and the people who live there. I think it's really important to do with any partnership, to do everything that you say you're going to do, to go above and beyond. The first year I did a press release and we got some really great press that helped Comfort Food Community on our social media. We're always promoting whatever they're doing. If they're like I said, we're trying to get volunteers to help with them. We're going to promote any fundraisers they have, whatever we can do to help them be successful. The same with reporting. I have one of the state requirements for my position is that I have what's called a coordinated outreach services advisory committee. And so now somebody from Comfort Food Community is on that advisory committee for me, and I serve on the board of Comfort Food Community. So there's a lot of kind of cross-pollination and working together. And we really see that we're all headed in the same direction. When they started talking about their edible education ideas, I was like, "Ooh, do you know about culinary literacy?" And of course, being a librarian, I sent them way more information than they wanted about it. But they were really open to it. So it's just been a really great thing. So a lot of it is, it's really just talking to people.
Great, thank you. Have you had any pushback or complaints from members of the community who feel like the project shouldn't be happening in the library, or that they don't want the type of people, I'm doing some finger quoting there,
Yeah.
that might qualify for, although you did mention that all the library staff did,
Yeah.
might qualify for this?
No, we have had zero pushback. Everybody is really into it. And again, like, we are not promoting it as a program. I mean, we are definitely addressing food insecurity, but again, when we have the stuff there, it's for anybody to take. Like, someone's making dinner and they need to grab garlic, they're going to take a clove of garlic. Good. Like, it's available for anybody who wants it. So it's not about identifying people with needs or attaching stigma to them. It's really about just making good food available to everyone. What we have found is that all the libraries that do it is that a lot of people are donating more money to the libraries because
Oh,
they'll come in and they'll, like, grab a tomato or two and give them $5 or whatever, it's like, so, and but also that they see it as an extended service. Like, I think yeah, no, we have not had any negative pushback.
wow, that's great to hear. So we just have about 2 minutes left. So the last question I see is, did you incorporate any diversity and inclusion training for staff who support patrons at the library?
Oh, interesting. Well, we did actually, so I will say, through the system, I also organize professional development, and we've certainly done diversity and inclusion for all of our member libraries and all of our member library staff, but it was not specifically about, it was not specifically for our farm to library libraries, if that makes sense.
Yeah,
So,
that makes sense.
yeah, but that's actually a great idea. I did not think about that. I will say that the libraries that are participating in this are really, really proud of their work and really excited to see new faces. And what they've seen is that people who didn't come in, like, people have ideas about libraries. And if you have literacy issues, you tend to think that libraries aren't for you because people still think of libraries as being a place where we keep books. And what happens is when people go because they're picking up some fruit or vegetables and they see that, oh, there's computers, there's air conditioning in the summer, there's programs for the kids, that they've seen attendance at programs go up. Oh, and one of the things, so when we got the money that we could do the marketing, the other thing is we gave money to each of our libraries to do programming, and I forgot to talk about that. And like the Pember did a program on canning and preserving, and Schuylerville did a cooking class for kids. So like everybody is also integrating more programs around food to use the food that is coming from Comfort Food Community. So it's been a great opportunity to expand that. But yeah, overall, the library staff and everything are just really, really proud of this program. And also they're benefiting from it. Like I have to say this, because we're in small communities, there's a lot less of like us and them. Like these tend to be pretty depressed communities, and I'm tremendously embarrassed to say public library workers are not paid well.
Yeah.
Really not paid well, especially in our small libraries.
Okay, we're right at 2 o'clock. So I want to thank you so much, Erica, for taking time out of your day to present this for us and share this information with us.
Oh, my pleasure.
Wonderful
Yeah.
program.
Hopefully my pleasure.
Hopefully next time you do this, you'll get a lot more people saying yes, they're doing something.
Yeah.
Great. So for those of you who are looking for the CE link for this class or certificate of attendance, I will be sending that out in an email when the recording is available. So in about a week.
Thanks for watching. This video was produced by the National Network of Libraries of Medicine. Select the circular channel icon to subscribe to our channel. Select a video thumbnail to watch another video from the channel.